I'm Dr. Ivana, board certified OBGYN here. So let's talk a little bit about an ectopic pregnancy because I've heard so much information out there and I wanted to dispel some myths. So an ectopic pregnancy occurs when the pregnancy is outside the uterus. That's just a general definition. So 90% of the time, the pregnancy will be in the fallopian tube. And the fallopian tube only can stretch so much before it bursts. And when it bursts, then you can have internal bleeding and essentially have your health compromised. Now, there are other locations for ectopic pregnancy. You can have the ectopic pregnancy in the corner of the uterus, which is the corner where the tube meets the uterus. And that area, since it has a little bit more muscle, can stretch even further. So you might have an ectopic that is not detected till later in the pregnancy. Another location is a cesarean scar ectopic, which is very rare, but it does occur. Another location is your cervix. You can have a cervical ectopic. 1 in 9,000 women will have a cervical ectopic. And then you can also have an abdominal ectopic pregnancy. So whenever you have an ectopic pregnancy, it is not viable, which means it does need to be treated as a non-viable pregnancy, and treatment will depend on where it's located as well as if there's rupture, which means you may need surgery. Now, an ectopic pregnancy can be detected early when you come into your doctor for a pregnancy confirmation. Your doctor will do blood work or urine tests, confirm that you're pregnant, and then do an ultrasound in order to determine where the pregnancy is located. If the pregnancy is found in uterus, then all is well. In rare cases, you may have what is called a heterotopic pregnancy. And a heterotopic pregnancy is when you have one pregnancy in the uterus and another one in the tube. And that is commonly found when patients are undergoing in vitro fertilization. A heterotopic pregnancy is rare, but if it occurs, it will occur with patients that are going through an IVF. So whenever you have a pregnancy test and you don't know where the location of the pregnancy is, you do need to follow up closely with your doctor with blood tests and ultrasounds in order to determine where the pregnancy is. And if you start to have abdominal pain as well as bleeding, it is advised for you to seek a medical care promptly. This is still a leading cause of maternal mortality in the first weeks of pregnancy. So I hope this helps someone. Until next time, continue to bloom.